Welcome to Healthbeat Live. My name is Jayni. I'm reporting for Healthy NewsWorks from Norristown, Pennsylvania. On this video call with me is Dr. Karen Hudson. She is a social worker and is the program leader of the Homeless Health Initiative at Children's Hospital of Philadelphia. Her program oversees several shelters in Philadelphia where doctors and nurses volunteer to care for sick children. Dr. Hudson, thank you for taking time to appear on Healthbeat Live.
Jayni, thank you so much for the invitation to be on Healthbeat Live with you. I'm really excited to talk to you today.
Thank you. Dr. Hudson, given the current situation, how has COVID-19 affected your program's homeless shelters?
Let me just start by first describing my program a little bit so that I can put that in light of how we work with the shelters. So my program is called the Homeless Health Initiative, and it's a community health outreach program that operates out of the Children's Hospital of Philadelphia. So we use lots of different healthcare professionals as volunteers to go into some local family shelters in the Philadelphia area, and they provide free health care to the children that are living in these homeless shelters. So these volunteers are doctors, nurses, dentists, social workers, all different kinds of therapists, and we use lots of different medical students, dental students, nursing students, you name it, and just community volunteers that really help us to take out free healthcare programming and other programming into the shelters. So because of the COVID-19 situation and the fact that everybody has been asked to be socially distant during this time, our hospital has mandated that, and the shelters have also mandated that. So that means that my program's volunteers cannot take actual programming into the shelters right now during this time as much as we would like to. So what we've had to redevelop ourselves in ways where we're on the phone a lot with the shelters, providing support to them in as many ways as we can around medical guidance. We're also on lots of emails and organizing drives to really understand what are the needs, the critical needs that the shelters have right now during this crisis. And then we are trying to organize and mobilize our volunteer pool to support the needs that the shelters have right now during this time.
Amazing. I've seen pictures of beds that are very close together in homeless shelters. So what are your homeless shelters doing to practice social distancing and prevent the spread of the disease?
That's a really good question, and they're doing a number of different things. So a couple of things that they're doing are, if shelter residents can actually leave the shelter to go to stay with some family members during this time, then they're allowed to do that. So that helps to reduce the number of families that are currently living in the shelter. And so now you've got a little bit more space because you've got less families in the environment. And things like when they serve meals, instead of serving one big meal with a lot of people in the dining hall at one time, they've split up the meals so that they're now offered through different shifts so that there are less people per meal eating at the same time. And even in the dining rooms where they are, they're socially distant from one another.
My last question is, what can kids do to help people experiencing homelessness during this time?
Now that's a really good question, and that's the kind of question that's going to require some real initiative and a dedication and commitment, because the kids can't go out, they can't go to the shelters. But one of the things that we're doing is, again, just trying to figure out what do shelters need. So if kids can go to the websites, kids and their parents can go to the websites of these different shelters in your area, or call a shelter and ask them what they need. Many shelters will have like a wish list. It may be like an Amazon wish list of what are the kinds of things that they need, or if you call, they may be able to tell you what they need right now. then if you could go on a site like an Amazon and order some of the things that they need and send them directly to the shelters, that would be very helpful to the shelters indeed. Another thing that I heard about recently in Philadelphia, which I thought was just really a cool project, is because people are having to stay in, but yet they're also encouraged to go out and walk and get a little exercise. There's this project called like the Rainbow Project, where lots of people are making rainbows and putting them in their windows. Have you heard about that?
I haven't heard about that, but that sounds fun.
You know what, it is really cool, and it is fun. And so when I heard about this project, it was more like the rainbows are being used as a symbol of hope during this time of crisis right now. And so while people are out walking and they see these rainbows in different people's windows, they're reminded, that this is hopefully short-lived and there's hope that's going to come from this. So one of the things that made me think about was, I wonder if we could do something like that in the shelter. Could we bombard the shelters with rainbows so that they could also that could be a sign of hope for them living there during this time and dealing with this crisis as well. And so that's something that I think that kids can do in their time while they're at home. They can make lots of rainbows, paint them, draw them, however you want to make them. But if there's a way to together, combine them and have them sent into some of these different shelters.
Again, thank you so much for your time, Dr. Hudson. We really appreciate everything your program does.
You're so welcome, Jayni. I thank you for your interest.